Welcome.
Thank you, Dr. Barry. I'm so happy to be here.
Well, you're not more happy than I am. I am so proud of what you've done so far. I love seeing you on Twitter fighting the tweet wars with people who think that the answer to severe obesity is to move more and eat less. And we're going to get into that and so many more topics today. We've got before and after, before and during pictures that we're going to share uh, with Amanda's permission. And let me say this before we get started, neither Amanda nor I are fat shaming. This is not about that. This is about improving your health. I used to be severely obese. Amanda used to be severely obese. We are not shaming you. We are telling you that it's not healthy to be severely obese. That is an objective fact. That's number one. Number two is that you can reverse your severe obesity by following the simple steps that Amanda and I are going to lay out for you as we go through this interview today. Amanda, tell us a little bit about your background and your story. And I really want to know, what was your motivation? What was it you said, that's it, damn it, I'm done?
So my background's actually in physical therapy. I don't practice anymore, just of my own choice. But for about 10 years, I've worked in hospitals, skilled nursing facilities, and at last home health. I have actually worked in healthcare from the time I was 16. I kind of started off working with the therapist there, and then I went to college and then became one myself. Anyways, yeah, my journey started off as I was a normal kid, not overweight. Then I had some childhood trauma happen, and no one in my family knew what had happened. And I learned to deal with my emotions by eating. My mom, I watched her be a size 4 and eat a bag of candy because she had a lot of things in her childhood happen, and that's how she learned to deal with it. So here I'm watching my mom do it, so I start doing it. And by the time I was about 12, I started gaining weight, and I gained, I don't know, 10 to 20 pounds every year since then. I'd also been on antidepressants since then was the time I was 12 years old, or on and off. So I'm 33 now. So for the past 20 some years, I probably got around 200, 225 in my early 20s. I was still active. When I was at university, I would bike 6 miles to and from. I didn't feel good though, because by the time I hit 18, I had started developing autoimmune issues, as well as I have a polycystic ovarian syndrome. So when I was 18 as well, I had to have my left ovary removed. I just had a lot of health stuff happen. And then, life continued. I got married. I got more depressed because I'd experienced depression from pretty much ever since I can remember. And I just gained weight and more weight and more weight till by the time I was 32, I was 360 pounds, having to use a rollator walker. It's one of the walkers with the brakes in the seats, because I couldn't walk more than a few hundred feet at the time because of the shortness of breath from the exertion, as well as my severe back pain that I was having.
Yep. And I'm going to pull up some pictures here while we talk.
Yeah.
Now, tell us about this is when you were 26. Is that
Yes.
right?
Yeah.
And so I'm guessing that the reason you took these two pictures then was because you had on in your mind, I'm going to lose some weight. Am I right about that?
Yes.
Yes. And so this was long before you decided to try the carnivore diet.
Yes.
What diet were you about to start right here? And then also I want the full list of all the diets that you've tried that just didn't work long term for you.
I was starting paleo here. I've been very blessed that my husband has been always willing to jump on every diet we've ever done. And I ended up falling head first off of paleo. And then obviously I gained a lot more weight between that time and the time I was 32. So within the next 6 years of my life.
Yep. And what other diets have you tried that were just like, this is dumb?
I have been on a diet since I was 12, funny
Mm-hmm.
enough. My
Mm-hmm.
dad, and I'm not angry at him for this anymore in my life, he used to make my sister go in the bathroom and weigh with me because, and he didn't know what was wrong with me. He didn't know why I was gaining weight. I was the only child, gaining and getting overweight. So I've done things like Weight Watchers, the Whole30, paleo, obviously, keto. I've done like whole organic veganism. My favorite worst one was I ate boiled white potatoes for only a few months. Like,
Oh,
that
wow.
is all I ate. My poor husband did that with me.
Poor guy. That now
Yeah.
that's bad. Eating paleo with you, that's just being a good husband. But if
Mhm.
he ate nothing but boiled potatoes with you for a few months, then he's husband of the year material.
Yeah, yeah. I mean, we did just pure calorie restriction. The one thing I always heard growing up, eat more, move less, eat
Yep.
more, move less. And so try the calorie restrictions. And that's the whole like the Weight Watchers, you get the points that you can eat XYZ. And none of it ever made me address that I am a binge eater. I am an emotional binge eater.
Yes.
And that's why the whole paleo and keto failed for me because I found that I always tried to remake those recipes. Like, oh, you want pizza? I'm going to make a keto pizza or whatever. And then eventually I just slowly fell off the wagon.
Yep, absolutely. And so, and this is not your heaviest weight in this picture.
Mm-mm.
I think that came in your early 30s, right? So
I want to
let's
say I was probably 265 there, something like that.
265 and had high
Mhm.
hopes for the paleo diet. But and that's how I started as well because I was 297 at my heaviest weight. I'm a little
Mhm.
bit taller than you, so that's not as bad,
Yeah.
not as unhealthy. But on paleo, man, the sweet potatoes and the quinoa and the hummus, honey, let me just tell you, I could put away some paleo food. And I did notice that my mental health got a little better on paleo. I wasn't as crotchety and angry all the time. I maybe had a little bit of body recomposition, but there's just too many carbs in paleo for somebody like me. And
Yeah.
you, especially, you were using food as the only therapy that you knew because your trauma happened when you were very young, and that's what you used to self-soothe with. And
Yep.
so let's see, our next picture here is tell us about this picture.
That is 2 weeks after I had started Carnivore. So I started Carnivore June 20th, 2022. So 2 weeks after that, middle of July, I took these. This was some of the hardest pictures I've ever seen. I cried
Yeah.
terribly when
Yeah.
after I took them. And
Yep.
I don't think I really, until I sent them to you, I haven't really looked at them.
Yeah, it's got to still
um,
be very emotional. Lori says, "I can't imagine putting your fatness on display. You're so inspiring." And let me just thank you for sharing because I know it's not easy. Even now that you've completely transformed yourself, this has got to still be painful to look at
yeah.
these pictures and remember because you remember how you felt right at that moment, don't you?
Yeah, I probably shouldn't put a makeup on. I'm gonna cry. Watch me. Uh, when I look at these pictures, all I think about is like this is just the nitty gritty. At 360 pounds, I got to the point where I was struggling to wipe my own butt.
Yep.
Taking like hygienic care of myself, I had to have a loofah on a stick because like I had lost the range of motion. It's called
Sure.
soft tissue approximation. That's how the healthcare say you real fat and you have so much fat you can't touch parts of your body.
Right.
And I look at that and that's all I see is struggling the like this is getting real into it. I remember having to go into the bathroom, having panic attacks if we went somewhere because it's like is the bathroom stall going to be small enough like I can use my own body weight so I can, like reach. I mean, it just
So you can kind of angle yourself and get your shoulder wedged so
yep.
you can reach. Yeah, no, I totally get that. And I remember when I was at my biggest that I had to worry about certain situations and like going on a plane flight was not fun at all. I could
Mhm.
fit into the seat and I could extend the seatbelt all the way out, but buddy, let me just tell you, there was not a lot of playroom there. If I had waited a little longer to get started, I would have had to have asked for the extender. Now, is this the point in your life when you were having to use a walker?
Mhm.
Yeah. So,
Yeah.
and so if you went over 100 or 200 feet, you'd have to use a walker.
Yeah,
And you were how
I
old
had
were
to
you?
sit down. I
How old
had
were you?
Go ahead.
How old were you here?
32. So
You
this
were
is literally middle of July last year, these pictures are from.
so you were effectively disabled. Speaking just from a physical therapy angle,
Oh,
you
absolutely. I would have qualified for disability because my husband pretty much had become my caregiver to
yep,
some degree. Like,
yep,
I mean, I could obviously feed myself, but he went and got the groceries. He did most of the cooking because I couldn't stand. My low back was in such bad shape that I couldn't stand to do the dishes literally more than a minute at a time.
Yeah. Yeah. Now we're filming this live in front of our private community right now, and they're able to ask Amanda questions. So if anybody in the tribe, if you have questions, type the word question in all caps and then ask your question for Amanda. And we're going to take questions from the private community members during this episode. So is this the point where you said enough? That's it, damn it.
About 3 weeks before these pictures, a little bit less than that, probably. I
What
I'm
happened?
one of
Tell us
these
the
I'm gonna
story.
go to the hospital, I better be dying kind of people because
Yep.
I've seen it so much where people are like, they'll have indigestion, they call 911. Anyways, I woke up the morning of like the 20 something. It was a couple days before the 28th. And I was having this terrible lower quadrant right abdominal pain. Like it was stabbing. And I told my husband, I'm like, I think I may need to go to the emergency room. So we loaded up, got in the car, got all the way to the front doors of the emergency room. And then the pain had subsided. And I'm like, nah, we're not going in there. It's fine. It's just, I don't know. Maybe it's trapped gas. I don't know.
Yeah.
And went home. Literally 30 minutes later, I was sobbing, crying. We actually called 911. And by the time they came, like literally it was 20 minutes later. Thank God I wasn't dying. And they like checked my blood sugars. They kind of just like looked at me and like, you're super morbidly obese, whatever, you're fine. And they're like, there's nothing wrong with you, and left. Well, then I waited an hour and then it just got to the point where I couldn't take it. And by the time we had gotten back to the emergency room, they actually had to get a wheelchair because I just couldn't walk. And I've never been in such pain in my entire life. And the poor people in the emergency room were just listening to me wail. Like I didn't care who heard me scream. It hurt so bad. And it turns out I had a kidney stone. And funny enough, my mom has had a few in her life, and I just never imagined it could hurt as bad as it did. And the emergency room doctor told me that they can actually be more painful than giving birth.
100%. And that's one of the few conditions that I've had female patients tell me that hurt worse than natural childbirth. And if a woman's willing to say that, you don't want that. So I totally believe that you were in 10 out of 10 ungodly pain.
Oh, yeah. Yeah. I mean, I'm one of these because, in the medical field, it's tell me your pain on a scale of 0 to 10. And me, it's like if you say 5 or 6 or higher, you better be crying at least
Yep.
a little bit.
Yep.
And I was just sobbing. They gave me the drugs and stuff to help. And I just remember looking over at my husband, he was absolutely just concern and worry on his face. And just in those moments of looking at him, and I realized, okay, we've been married 7 years last year, and he's spent 7 years of almost hell. I mean, obviously, he loves me and we've had good times, but 7 years of just watching me just literally spiral down, and there's nothing he could have done to stop me.
Yeah.
And in those moments, that's when it clicked. It's like, I got myself here. And it wasn't
did you feel?
blame or like in a negative way. It's just like every choice that I have made in my life got
Yeah.
me sitting in this bed.
Yeah. How much guilt do you feel about that looking back now?
I don't. I mean, I can't say don't feel any, but because I still work with this on myself, as I still do feel like every pound on me, it's like years of guilt and shame. But
Yeah.
now I look back on it, it's like, I made those choices and no amount of shame or guilt can change it. It's already done. It's already in the past. And that
Absolutely.
shame is just what led me to always wanting to eat because I felt so bad.
Because that had taken you down a bad road a long time
Oh
ago.
yeah.
So why go down that road again? I
Oh yeah.
totally get it. I totally get it.